So here we're going to look at massage tool for the forearm. So using instrument-assisted soft tissue mobilization, or IASTM. So let's talk about the tool. So here I'm just using an inexpensive jade gua sha tool, but you can use an IASTM, so instrument-assisted soft tissue mobilization blade, if you've purchased one online or you are a massage therapist or fitness pro yourself. So feel free to use whichever you have. Now, the tool is really important because that is how we're going to target that layer under the skin. So pressure, let's talk about pressure. This should not be painful. It's a light pressure, 45-degree angle of the tool. And as you can see on these scales, it's about 50 to 100 grams. So it's a light pressure allowing you to feel the tissue. So let's look at the technique. Start by adding some lotion or oil to the forearm so that the tool can glide easily. Remember, it's a bit of light pressure. You want to feel that layer under the skin, 45-degree angle. And then you're going to gently rub up and down those soft tissues of the forearm, so all around the forearm. And once it's comfortable, start adding movement, flexing and extending the wrist, even a bit of pronation, supination, a bit of rotating the forearm there. So what you'll find is some areas feel lovely, soft, easy, where others feel crunchy, hard, maybe sensitive, a bit uncomfortable. And those are the areas where there's more tension, it's a little bit tighter, where the connective tissue doesn't move so well. So it shouldn't be painful. We want to work in a pain-free zone, but it may be uncomfortable or feel a little crunchy. But what you will find is as you move that wrist in all directions, you will feel that tissue start to soften under the tool, become less crunchy, less uncomfortable, and the movement at the wrist should start to come easier, reducing the tone of those muscles and the pull at the tendons of the wrist and elbow. So to summarize, apply some oil or lotion to the forearm. Use a 45-degree angle, really important. Fascia loves shearing forces. So we're targeting that layer just under the skin, not digging into muscle. And start to rub lightly that 50 to 100 grams of pressure with the tool. When it feels comfortable to do so, add movement. We want to create this ease in those tissues when you move. Flex, extend, pronate, supinate, whatever feels good. Perform daily until you start to see an improvement in the level of tone, that tightness in the forearms. Once that improvement is there, then perform as and when you feel you need it, based on your daily activities and exercise routine. Avoid working directly or on areas that feel acutely painful.